But most of the time, under the fold.
Under is
good.
Under the best because it disrupts the breast tissue the
Less
least.
chance of losing nipple or sensitivity there?
There is, as I said, yes, there is, because the breast tissue is disrupted the least. So there is less chance of scar formation. There is less chance of breast tissue contracture. I've seen that with procedures where the scar around the areola was used, and as you dig through the scar tissue, through the breast tissue, it causes scarring, and that scarring stays there, and you can see actually ripples through.
So it's not worth the risk then, in your opinion, to go through the nipple area?
In general, I think for pure breast augmentation is somebody who does not require any manipulation of the position of the nipple. It's best to stay away from the nipple. Now you have to remember that a scar through the nipple is always visible. You'll always see it. But a scar on the fold, underneath the breast, you may or may not see it. Most of the time you don't see it because as the implant drops into its natural pocket, it will camouflage that scar very, very well.
Okay, what about the armpit?
It's a good procedure. It takes longer. It's more involved. There are...
and why does a woman, I guess women come to you and say, I want through the armpit area? Do they ever say that? I mean, they're educated.
They do.
Today.
Most of the time it's because they think that the scars under the fold are horrible to deal with. But the truth is that nobody ever comes back to complain about the scars under the fold. You just don't see them.
So through the armpit is just purely...
It's purely preference by the surgeon at that point. As I said, it's more involved, and it's one needs to be extremely careful with that procedure because...
Why?
One has to disrupt the fold in order to achieve a natural look with that procedure, and one needs to make sure that exactly the same thing gets done to both sides, and that usually means that more time needs to be spent in the operating room to release the breast tissue around the fold so that the implant can drop. And if you don't do that, the implants end up being high with that procedure.
What about through the belly button?
Here's the main issue with going through the belly button. Even though you spare the patient the incisions over the folds or anywhere else, the problem with it is that the implant cannot be accurately placed into the desired pocket. There is no way to be able to place that implant under the muscle like you want it, release the muscle as much as you want, and make sure that the same thing gets done to the other side exactly similar exactly
so it's just less control.
It's a lot less control.
Are there guys doing it in Texas?
I know of quite a few surgeons who do it.
What we're going to do is we're going to take a quick break. Come back, you have photos. I have questions about silicone versus saline, and also how you determine size.
Very good question.
That day. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're here with Dr. Ahmadi, and we're discussing the keys to creating a natural-looking breast. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're here with the go-to guy, board-certified plastic surgeon in Texas that is getting amazing results with his patients. And we're talking about creating a natural-looking breast, and you say a lot of that is in the hands of the surgeon. There's art to it. They're not all being done the same way. No.
A lot of patients coming to the office seeking breast augmentation or lift, and they've been on the internet quite a bit, and they have bits of piece of information, but they can't put it together. So it's the job of the plastic surgeon to listen to them first, see what it is that they're after, and then guide them.
Let's start there. Day one, a consult. What happens when they're with you?
Well, you know, usually they're nervous, and sometimes they bring in pictures, and I start the interview basically by asking them what it is that they want to have done. What are the goals? What are they trying to achieve? Why they're having the breast augmentation? And there are a lot of stories, but usually comes down to about 4 questions, and that turns out to be what size, what sort of an implant, you want to go above or below the muscle, and what incision. Those are the 4 major questions, and you'd be surprised how different, what kind of information they have and what different answers they have to all these questions.
Do you want to know what they know?
Absolutely, because it tells me whether they're educated about the procedure or not.
Okay.
So I'll let them tell me or educate me, you know, about themselves, and then I take it over from there, because find it important for them to tell me what it is that they're after.
How do you determine size?
Well, size is probably the most important factor.
For creating a natural looking breast.
Absolutely. Here are the goals. You want to achieve a very natural aesthetic goal. And how do you go on about it? Well, it's individualized. It doesn't matter whether you bring in someone else's picture out of a magazine. What matters is what you want to end up looking.
Okay.
And the best way to do that is try the implants on. The plastic surgeon
in your office.
In your office, the plastic surgeon should not tell you what size implants to go with right away. A lot of people come to my office and they have the exact CC because some girlfriend told them that's what size implant I got from another plastic surgeon. And I stop them right there and say, listen, breast augmentation is individualized. What fits on someone else's chest may not fit you. What matters at the end of this conversation that you and I are going to have in this office is what size implants are going to look good on you. And the best way to do that is just to try the implants on. So we get a bra, we get different size implants.
But how accurate is that?
It's very accurate.
Is it really?
It's very accurate. Basically, the only difference between what we're doing in the office and what goes on during the operating room is that the implants in the office are above the skin, and in the procedure they end up underneath the skin.
Okay.
So the volume is very, very accurate, and I tell them to bring a very tight-fitting shirt.
Okay.
And we have mirrors set up for this purpose where they can look at themselves, you know, head on and 3/4 and on the side. And I ask them to constantly look at their silhouette. And if they're comfortable with it, they usually end up narrowing the size of the implant very quickly. They know what they want.
Oftentimes they say, wow, this is way too big for me.
Not necessarily.
Okay. Sometimes they need bigger.
What happens usually, they come in very shy about the procedure. The first word that comes out of their mouth is that I don't want to become too big. And I sit back and say, okay, go on. I'll let you choose the implants. Then I step out and my assistants help them with putting the implants on.
So your assistant's always there during
Absolutely.
this? A female assistant?
Yes, absolutely.
Okay.
And then usually what I end up coming back seeing is they've narrowed it down to 2 size implants. And the rule of thumb is if you narrow down to 2 size implants, you're already on your way to picking up the right size implants. And here's the rule of thumb. Always go with the bigger implants because that's what you really wanted. You may not verbalize it, but that's what you really wanted to begin with.
Okay.
Now,
okay.
if you go with the smaller implants, I almost guarantee you, I'll put my money on that you come back and wanting me
a lot of regrets
to go and exchange it for the bigger implants. But the ones that went with the bigger implant of the 2, and we're not talking about a huge size difference. We're not talking about an entire...
So you're not one of these surgeons that does the big, giant...
No, I absolutely try to stay away from those giant implants purely because of the health of the patient and the fact that they have associated with a very, very large, you know...
Because a young person turns 40 and then...
well, what's going to happen to the implant?
And plus those breasts don't look natural.
They don't,
professional.
And that's not what practice is about.
Good.
It's about natural look. And then the next discussion turns out to be silicone versus saline, and that is
that is a good question.
It's a very controversial issue. As you know, the FDA brought back the silicone implants.
So give me the advantages of both, the disadvantages of both.
The silicone implants absolutely feels more natural than the saline implants long term.
Okay. It feels
more natural, absolutely, because it's filled with silicone and it mimics the human tissue. The saline implants, which is made of silicone shell, it's a silicone bag filled with water, saline, may or may not feel as natural, especially under the breast, closer to the fold. However, the silicone implant is associated with some other issues, including capsule contracture.
That's where they get hard.
That's when they get hard. Saline implant is associated with a lot less maintenance, and patients need to be aware of that.
What's popular in Texas, by the way? What seems to be the number one?
It seems that Texas, we seem to be doing more saline implants than silicone implants.
So you like saline implants?
I think, I don't have a preference for either. I think the patient needs to be educated about the pros and cons.